Hello, I'm Dr. Amy Shear, Medical Director.
Hi, I'm Ann Hopper, the nurse in the clinic. And we'll get started with the questions about these vaccines for Tuesday. Dr. Shear, the first question is, I don't want to get the flu vaccine. Can I just get the booster?
So I want to encourage everyone to get both. We are seeing, as compared to the last two flu seasons, where we did see less flu vaccine, mostly because everyone was staying 6 feet apart, there was increased hand washing, and we were wearing masks. We did see less flu, but we are this year actually seeing an uptake in flu, so I want to encourage everyone to get their flu vaccine. That being said, if you don't want to get the flu vaccine, I still encourage you to get the booster, the Pfizer booster. So all vaccines are important, and I want to make sure that we get, that you do get both. It's my recommendation that you have both. But if you just want to get one, you are allowed to.
I'm really concerned that I had a mild reaction after the COVID vaccine the first or second time. Is it safe to get both vaccines at the same time?
So it is safe. I know that we had this question several weeks ago, and I went and looked it up back then, and it did say that it was safe even then. My recommendation was at that time that if you don't have to get them both at the same time, to go ahead and spread them out just to allow your body some time to recover in between. That is certainly still an option if you have the luxury of doing that. So if you wanted to get, your flu shot outside of Cedar Field and then get your booster when the pharmacists are here, that's fine. I just know that this is what they're offering. And because these vaccines are so important, we do want to make sure that you have both. Regardless of how you want to do that, I do think you should get both a booster for those that, had the Pfizer as well as the flu vaccine. So even if you just want to get the flu vaccine and you've already had the booster, come and get your flu vaccine. That's basically what I'm saying is the more the better. So if whatever it takes to get you guys both vaccines, that's what we want.
How about if I had Moderna or the Johnson & Johnson vaccine? Can I get the booster, this Pfizer booster?
No, this is only approved as a booster for the Pfizer if you had the Pfizer shots. So if you originally had the Pfizer vaccines, then this is the booster for those that are, for those in the time period of getting the booster. That being said, if you are immunocompromised and you had Moderna, I do believe which is not a booster vaccine, that's a third shot, is approved, and that has to do with your immunocompromised status. And they are saying there's no scientific evidence that a person that had Moderna couldn't get, that there's any problems. And there's been some crossover of patients in certain other facilities in other states where they've gotten Moderna than Pfizer. There's no problem with that. It's just that it's only approved for Pfizer. So we're not going to dispense to anybody except for those that originally had Pfizer to get a booster of Pfizer. And then I'm sure Moderna will have their boosters, coinciding to when their antibodies go down. So,
if I had the COVID-19 virus, do I need to get a booster?
So, even if you had COVID-19, we're still recommending vaccinations. And the reason why is your response to COVID-19 is variable. Just like with any virus that you may get, some people get really sick, some people get mildly sick. We don't know your response to the novel virus. Whereas with the vaccination, we've studied the response. So we do know the response that, by and large, you will get to the vaccination. That's why we are encouraging, regardless of if you've had COVID-19, we're still encouraging you to get vaccinated as well as boosters. The only time that they're saying that you're not eligible for a vaccination is if you have received monoclonal antibodies, which is an IV infusion, which is for treatment of COVID-19. So if you had COVID-19, you went in for an IV infusion treatment of antibodies, then you're not eligible to get the vaccine for 90 days. And that's the same for the booster. So you could not get the booster for 90 days from the time period in which you had the antibody infusion. So it's a little confusing because I know there's a lot out there about, well, they told me to wait. That's really a misinformation. That waiting period is the 90 days from the antibody infusion. So unless you had an IV antibody infusion, then you have to wait. Otherwise, you can get the vaccination as long as you're feeling well.
Okay. Should I take any Tylenol before these vaccines on Tuesday?
So just like when we had them in March, it's the same information applies. So if you normally take Tylenol in the morning, go ahead and take your normal medications in the morning. And then it is a good idea after the shot to go ahead. I would not pre-take any medication, so there's no medication that I would recommend that you take before getting the shot. But if you want to take some Tylenol or ibuprofen afterwards, that's fine. The biggest thing to do is just to make sure that you're moving your arm a little bit, because the biggest thing I think we all saw was a sore arm after getting the shot. And that is a little bit less for those that are able to move and exercise that arm to some extent. And also just an ice pack on the arm does a world of difference. So I would encourage kind of a little bit of movement as well as some ice after the vaccination. If you want to take some Tylenol or ibuprofen, that's fine, but you don't need to take anything beforehand.
And do I need to hold any medications the morning of the vaccines?
So by and large, they're saying, just like last time, take all your normal morning medications as you would normally take. There's no recommendations to hold anything. There may be some exceptions for people that are on things like methotrexate or some of those immune medications. Again, if you are concerned, go ahead and reach out to your rheumatologist or doctor to ask. But for the most part, blood pressure, cardiac medications, diabetic medications, the medications we most commonly see, there's no indication to stop any of those or hold them for the day that you're getting the vaccine.
Do you know if there are any different types of side effects that we might have from these vaccines?
Not any different from what the original vaccine we were seeing. So we're not seeing any new side effects with the booster. And from what I, anecdotally hear, most people are saying it's, kind of like the first shot that they had, a little bit more mild. It tended to be that second vaccine shot that had a little bit more symptoms with it. So this one has been fairly well tolerated from those that I've heard that have gotten it.
And why is it so important for Cedar Field team members to be vaccinated?
So they actually, I try to keep up with all of my medical journals and articles. They did post something recently that I felt was really interesting, where it looked at kind of the importance of, your community rates of positivity and your long-term care community rates and how they coincided. Because back in the beginning of this, we were seeing large outbreaks in long-term care communities especially in nursing homes, those settings. What they actually went back now and are finding is that the most important component of all of this is actually the caregivers in those settings, because they are the ones that are more likely to be outside in the community. So in a community where the positivity rate is high, bringing that back in that's why it's so important that our team members are vaccinated. Because as we saw in other states, and even our own, most of the time the residents in the community were, the level of vaccination status was very high. Luckily, Cedarfield is one in which the team member rate was also very high, but there are many more communities out there where the workers, the rate of the vaccination status of the workers was very low at the beginning when vaccines were first offered. And that's where they were seeing more of those outbreak cases of, even though the residents were vaccinated, they were having infections of COVID-19, which is why I think Cedarfield initiated the requirements. But the good news in all of that is that when we can get team members vaccinated, and that's why it's so important that we have vaccination of everybody on campus, the rates really are very, very low. So we're not seeing even that, you still have 1-2 outbreak cases, but not nearly what we were seeing, March of last year. So, and prior to. So
two questions came in.
Uh-huh.
To repeat this question too for everybody. Can I get the flu shot only next Tuesday?
Can I get the flu shot only?
Yes, you can. You can get the flu shot only, especially, if you didn't get the Pfizer originally, come in and get your flu shot. So we want you to be as vaccinated as you're able to be. So yes, we are offering for those that do not want the booster, you are able to get just the flu.
If I get the booster off campus, do I have to absolutely tell Ann Hopper?
If I get the booster off campus, do I absolutely have to tell Ann Hopper? Yes, you do. Dr. Scheer doesn't need to answer that. Yes, you do. I need the copy of your card. Thanks.
Any other questions? No?
Yes.
Oh, yes. Okay.
I have two, and if you'd repeat them. One, what is the relationship between a mammogram and the COVID? My understanding is you have to put the mammogram off.
So the question was about the relationship between the COVID-19 vaccine and mammograms, and there is an association there. You do have to hold one for a period of time, and I am sorry because I know I read that information somewhere, and now I can't remember what the recommendation is. So I would have to look that up, but I do know that there is some period of time in which you're supposed to hold off getting the mammogram, so there needs to be a period of time. But I believe if you've already had a mammogram, you're okay to get the vaccination. It's just if you get the vaccination, you don't want to have a mammogram within a certain time period.
6-8 weeks, I think.
Yeah, 6-8 weeks is what we're thinking, but again, I would have to look that up.
The other, for women or men who have had breast cancer, can they get both inoculations in one arm?
So the question was, if you've had breast cancer
And the nodes removed.
and your nodes removed, can you be inoculated on the same arm?
With both, with two.
With two.
Either arm, get two in one arm.
Right,
Yeah.
that's what we mean.
Yeah, I don't see why you couldn't get both vaccines in the same arm.
At the same day? That's.
And again, I would have to add, that's a good question, and I'll have to look that up. Not sure where I'd even find. I'd have to ask an infectious disease.
What changed your mind from being so adamant in the past to wait at least 2 weeks between the flu shot and the COVID booster shot? And do you really think it's a good idea to inoculate elderly people with 2 high immune response medications?
So the question is what changed my mind because I've been saying wait in between getting the booster shots and the flu shots. And so what changed my mind, and do I really truly recommend, is it a good idea to be giving both vaccinations that do, cause some symptoms and have been known to cause some symptoms in an elderly population. So for me, what I look at is, when I look at a public health standpoint, I want to look at what's going to save the most lives and what's going to decrease the amount of illness in a community overall. So while if I had a magic wand and could do it 2 weeks apart, I probably would. And that's why I've always recommended to wait. However, if this is when it's being offered, I do feel it's more important for people to be vaccinated for both the flu and to have the booster for COVID than I'm worried about the risk of the fevers and chills and sore arm. And that being said, although yes, there have not been a lot of evidence that I've seen of any cross reaction or difficulty that people have had it both at the same time. And that's actually how the pharmacies are offering it and how clinics are offering it. And I do feel like the reason for that is the amount of people that you're going to have to come back for a second shot decreases so that you're not getting 100% participation. So if you give everything on the same day, just like if you look at the rates of those that are fully vaccinated with Johnson & Johnson versus the rates of people that are fully vaccinated with Pfizer and Moderna, it's less because there's 2 shots in Pfizer and Moderna and only 1 shot with Johnson & Johnson. So what we found is it's hard to get people to come back for that second shot. Mm-hmm. Now, if I could guarantee that everybody was going to come back, then yeah, in a perfect world, I still think that it's an okay idea to get the booster on one day and wait a week or 2 to get the flu. And if you want to do that, you can. It's just I don't believe that the pharmacy is coming back to dispense a second time.
Yeah.
I totally agree with getting both of them if that's what you want to do. However, can you really say that there hasn't been overreactions to having both of them at the same time when theirs is not being accurately reported? When you have 2 at the same time, you don't know where the problem's coming from.
Right. So the question is
if anybody needs a ride 2 weeks from Tuesday to get their flu shot, I'll be happy to take you.
Mm-hmm. So I believe the question is, can we truly say that there has not been reactions to getting both at the same time? The frustrating thing with all of this is that we are getting the information as we're dispensing it. So, in a perfect world, I will have last year's data to say whether or not, what the rate of problems were. Should it be separated out? Should it be, given the same? Unfortunately, we don't have that luxury because this is the first time that the boosters are being dispensed. Now, what I do know is what is being recommended based off of what the CDC is putting out there, and what, and they are saying that there's no contraindication and that it is okay to get both. And all I can go with anecdotally is what people have told me, which is not, I don't like to use that evidence. I don't know if you can hear the hesitation in my voice by using, well, people have told me. I prefer to go off of, scientific evidence, scientific data, and all I can say is from what we know, based off of what is out there, there has not been any increased complications from giving both at the same time. Now, what that means to us, we'll see. Yes?
I jumped the gun a little bit said I got a third shot.
Okay. So there's somebody in the audience that was saying they had gone to the pharmacy and they were thinking they were getting a booster. It turns out it was the third shot. The good news is, it is, you don't need a booster if you've gotten a third shot. Yeah, you don't need a booster if you've got a third shot. Yeah, yeah. Your immune response is up there back in the original. Yeah. Okay.
All right.
Any other
Good.
questions, concerns? No? Okay. Thank you very much.
Thanks.